Opened our eyes, you also opened our minds. May I now request Dr. Anupam Sibal, Group Medical Director of Apollo Hospitals, to formally introduce a person whom I really don't think requires any introduction at all, Dr. Pratap Reddy, the Doyen of Indian Healthcare.
Good afternoon. Now, how do you introduce someone who doesn't need any introduction? Well, I'm going to try and introduce the architect of modern healthcare in India, Dr. Pratap Reddy. Dr. Reddy received his initial medical training in Chennai at Stanley Medical College, then went to the United States, did his residency in internal medicine, his fellowship in cardiology at Massachusetts General Hospital, which, as many of us know, is again the #1 hospital in the United States. In 1978, he came back to India, set up a practice, and it was in 1983 that he set up India's first corporate hospital, Apollo Hospitals Chennai, in what used to be then known as Madras. In 29 years, Apollo has grown and is today an integrated large healthcare delivery system covering primary, secondary and tertiary care with 70 clinics, 54 hospitals, close to 9,000 beds, a strong presence in health IT, telemedicine, pharmacies, consulting, education, research. Apollo, over the years, has treated as many as 26 million patients from 120 countries. Dr. Reddy has served as a catalyst for many path-breaking legislations, to name a few, allowing funding for hospitals in India, tax deductions for health insurance for preventive health checks, and the Human Organ Transplant Act. Over the years, many honors have come Dr. Reddy's way, including the Citizen of the Year presented by Mother Teresa, Lifetime Achievement Awards from many institutions like the All India Management Association, FICCI, universities across the globe, and of course the Padma Vibhushan presented by the President of India in 2010. Carlyle said that a great man shows his greatness in the way he treats little men. Over the last 15 years, where I've had the opportunity of interacting with Dr. Reddy, I can say that I have seen that in every interaction. So ladies and gentlemen, let's put our hands together to welcome a great doctor, a visionary, Dr. Reddy.
Namaste. Dhanyavad to Lee Sheperio. I think we had a very wonderful morning. I hope all of you would have felt what I felt in the early 80s when I lost a young man who couldn't afford to go to US because he couldn't raise $50,000, and he left behind a young 31-year-old lady and 2 children. I said, how many more are going to lose their loved ones because they can't raise that $50,000? Because you know what, at that time, India did not have the care that was available in the developed world. But today, we are very pleased that not just Apollo, the whole country, there are a number of hospitals which are able to deliver the same level of care that's available anywhere in the world. But you know, that is a 20th century story which has no relevance to today. Today, the health challenges are totally different. But they still belong to the same triangle. The triangle that was, if you see the vision of Apollo, or the mission of Apollo, it was clearly to show how do we bring healthcare of quality and greater access to a large cross-section of our people. And today it's very nicely put it saying, the iron triangle in healthcare today is quality, access, and cost benefit. I think this is the true things, even if we are able to bring in greater and greater quality. Because yes, let's give the credit to the clinicians, the surgeons and so on and so forth, and the technology that's backing us up. You know, I remember when I first bought the first whole body CT in the country into Chennai Hospital, Apollo Hospital, everybody called me crazy. Dr. Reddy, you are spending nearly 30% of your whole hospital cost onto that one machine. But today, whatever technology that's available anywhere to manage people, we brought it. You know why? Because we felt the patient everywhere is the same. We must be able to do continuously address his concerns. This is where we always believe, and we should never forget, in healthcare we need technology, we need all the researchers and the scientists, but we must not forget that it's the patient who is in front of us, and all our solutions should go around him. And this is where I think there is a great opening that this morning we had when Mr. Ramaswamy spoke. He spoke at length about the ISRO. I remember when it's the first telemedicine, I think it's in this city, this is then called, it was named on the same day at Hyderabad. When the President Bill Clinton, his last visit to India as the President of the United States, when he came here, he connected my village to all our Apollo hospitals using the ISRO connectivity through telemedicine. He was amazed when he saw that one young child being advised and the mother being told by our cardiologist in Hyderabad saying, your daughter has got a hole in the heart, send the child to us. During vacation we'll fix it and then she can rejoin when the school reopens. But then the doctor was nice to add another word to the mother, saying the child will lead a normal life. That touched the president very much. He said, Dr. Reddy, many people across the world should use this so that this benefit of technology will pass on for people in multiple distances. I think truly that's what we're talking. This is what ISRO then gave. And today we hope, when Raghavan talked about PPP, we will certainly make the ISRO, which has got larger space today, available for a lot of people, for healthcare people to use, and use the today's 21st century innovations, 21st century digital innovations, along with the great improvements that have taken place both in biology and, of course, whatever the various hospitals have done. Mr. Brahmachari again, was very powerful in saying, we welcome. He used saying, Dr. Reddy, you are our neighbor in Delhi. We have the most powerful computer. We have got great models of research, and we are testing out. It's really working. I think that's a great eye-opener to clearly say that we are not two distinct parts. The scientists, sometimes we felt the science and the real medicine is different. From Mr. Brahmachari's very open offer, saying we'll work together and make a difference in people's lives in finding new treatment methodologies, newer drugs, and give it to the rest of the world was very, very forceful. And of course, the last speaker in the morning was a great man. He was a professor at IIT. We knew him, and Professor Ganapati very often brought him to the hospital when we thought he had a crazy idea, saying that he'll give these gigabytes of bandwidth at approximately no cost. But unfortunately, whatever we wanted this gigabytes of healthcare so that their point was, the government of India said that there are plans that a node will be available for every 6,000 Indians. If that's available, we thought that's the best way that the country could ride the health so that we could really reach the last mile. And then the constant thing that people are saying, everything is okay, this healthcare today, but they are not going to the villages. So here we promise, if the NKN is given, we should be able to go to the last mile. What I really wanted to stress, I think, is the tremendous amount of effort that has been put by Sangeeta and our team in bringing all of you here. from different countries with different backgrounds, like what Lee Shepario has told, the 5 models of healthcare which is already working. What could we take from those 5 models? What can we bring others together in a participatory manner and make a significant breakthrough in a great crisis in health that's facing some of the countries? He can travel anywhere in the world, but he can't get care if he has some problem watching a football match. Can we solve this? I think yes, because if we put all our minds together, the various solutions that have worked and various new concepts that we have, I think this wonderful conference which has been organized should bring us together. So I think what we need is just not listen to a few more lectures, but at the end of the day, if we can roll out saying these are the 10 models which we will implement. The models should be very clear. Number one is what do we do? Develop a digital revolution to give access to people. Because I think this is the cry. And of course, Ganapati frequently says his geography has become history. So the distance is really no matter in telemedicine or telehealth. If that is, can we really put that into place using the methodologies that are now, the tools that are now available? The second thing is, how can we further access the quality of care? We know there is a great satisfaction for all of us today, as doctors saying, we are making a big difference in treating majority of the diseases according to us in the best possible way. But according to us, best possible way is not really the very best. So I think the digital utilization and bringing the processes aggravation could bring to that perfection in the delivery of care. And finally, the cost benefit. Cost benefit is very clear. They have already said, but I know when we first started this telemedicine, between 100 miles, it was prohibitive cost for the patient. Even if the doctor said, I don't charge you anything, unfortunately the cost was tremendous. I hope we would be able to solve that cost through the revolution. All that I want to add on is to saying that we have great responsibility. You have demonstrated your responsibility and eagerness by participating in this wonderful conference in these 2 days, where we are not only going to talk about how do we revolutionize the way we care, how do we also revolutionize the way we think about the patient. I think ultimately, it's a great effort. I'm very pleased, and I congratulate every one of you for having participated in the conference. Let's walk home and then say, let's take these ideas and say, I'll make a difference to a lot of people who never had an access or an advantage to good health care. It's in ordinary terms to say universal health care is very essential. In the normal languages, we used to say health is wealth. So if that's what it is, we can create a tremendous amount of wealth by improving the health of our countries. Some of the problems I cannot but mention, being a cardiologist, Apollo, having started because of that one patient dying of heart disease and was deprived of the care. And today we are facing unprecedented pandemic. These non-communicable diseases. When UN held their first meeting in September 11, I see Preeta there. She also attended that first convention of the UN in September 11 on NCDs. We used to think that we are facing a huge problem with diabetes, heart disease, and cancer. And they have projected some figures. And believe me, whatever they projected for the 2012, it all crossed in 2007. The figures that they had given for diabetes or heart disease by 2020, we are going to cross before 2015. So it's truly a horrifying health scenario that we are facing, especially in this part of the world. You know, I don't want to use the word, but we said we have three major gold medals. We have the diabetic capital of the world, heart capital of the world, and cancer capital of the world. We don't want these medals, and this is where all of you can help us. And by helping us to build these solutions, I'm sure we will be able to take a lot of other things for several billions of people. Because India has got the unique advantage of the numbers. Sometimes these numbers, 1 billion, everyone said was a disadvantage. For health, I think it's an advantage today if you can apply today's thought process and the availability of the new tools which did not exist before. I sincerely hope that we will have a participatory action plans and then work and then see. Next time we review, it is not going to be saying what can be done. I think we would like to hear saying, Sangeeta, you'll probably get an action report saying, these are already happening. You know, they have already made an impact on millions of people. They have already made a big, significant difference in bringing this awareness of heart disease. They have taken the people. Truly what I would like to see is bring a personalized healthcare. Can we make the individual own his health? He does everything else. And he has a tool in his hand, and what you need is to empower him to use that tool so that he owns his healthcare. There is no way, if this is what is a pandemic, there is no way, even if Apollo builds not another 60 hospitals, even if you build another 160 hospitals, and all others join in this force, that is not going to be enough to tackle this health crisis that exists in India, similarly in all other countries. I'm just bringing India because it's 1 billion people. But what I think can be done, if we can use this technology to bring the ownership to the individual. This is why I said Apollo's new mantra we want to create is the word called stay healthy. Stay